Welcome to the Nursing Dose with your host, Farah, aka Nurse Farah, aka Dr. Laurent, nurse career coach. I am here today to talk about all things interview, and we're going to go through the 5 C's of interview success. All right. So, why is that important? Because I know there's a lot of nurses out there that are looking to transition into a new position. It's a change of season, the fall's coming up. There's different opportunities out there for you to get into maybe education, to get an education role, such as an educator, or maybe go into an academia role, or maybe going into a leadership role. So, this is the reason why I wanted to do this. A lot of people always ask me questions about interviewing since I'm a nurse career coach. I've been doing this for 3 years and I help all nurses land their dream job in less than 90 days. That's right. I work with all nurses, but the majority of the nurses that I work with happen to be new graduate nurses. I work with nurses from all over the US, all the different states, but they mostly happen to be from California and the New York City area, right? So, like East Coast, West Coast. Shout out to all the nurses who are currently watching. Let me know where you're watching from, what city, what country. And shout out to all my Canadians out there as well. I also work with a lot of Canadian clients. I too am Canadian. I went to school in Canada, got my bachelor's degree there. And I started out in the emergency department. So, really, my mission is to empower all nurses to really go after their dreams, their goals, and to go after them confidently and boldly. So, if you happen to be watching, thank you for watching. Drop down in the chat where you're watching from, what city, what country, any questions that you have about the job search process or interviewing, please let me know. I recently worked with a nurse from California. It took her months and months. She could not uh, get a position. And after working with her, after one session that I did with her on interviewing, she actually landed a same day offer. And a lot of my clients actually get same day offers. So definitely, if you're interested in learning more about what I do as a nurse career coach, you could just put down basically career coach down in the comment. You can send me a message and I'll be happy to get on a consultation call with you so that you could slay your next interview and land that dream job. All right. So I've been away from lives for just a little while, took a little break, but I am back. I'm going to be hopefully doing this daily for the next little while. And then I'll be also having different guests on where we talk about all things nursing, all things entrepreneur for those nurses who are interested in starting a side hustle or a business. And again, thank you for watching. So let's get into it, right? So, why is it important to really prepare for interviews? It's because we don't want to waste time, right? We don't want to waste the employer's time and you don't want to waste your time as well. And you want to be able to get the positions that you want. And for all my new grads that are listening out there, senior nursing students, please do not listen to any negativity out there. You will have clinical instructors and people telling you that you can't do certain things, you can't start in specific areas, but I'm here to tell you that it is possible and that you can, because it happened to me. As a nursing student, they told me I had to start in med surg, which is the old narrative that I want to break and shatter for everybody. You could start wherever you want, and you don't necessarily have to start working in the hospital setting, right? You can work in the community setting, you can work remotely, so many options. That's why we are in the best profession in the world, right? Nursing. I'm a little biased, right? Because I'm a nurse, but it truly is the best profession because there are so many opportunities. So today I'm going to talk about the 5 C's. These are Nurse Farah's 5 C's for interview success and how to slay your next interview so that you can land your dream job. All right. So the number one C that I'm going to talk about is competence. Okay. Number 1C is competence. So, what do I mean by that? So, during your interview, really the point of your interview is to display and demonstrate this competence that you have. So, obviously, the reason that you've got into the interview phase is because you are qualified, right? So, part of the interview process is to prove to the employer that you are qualified for this position. So it is very important for you to know the job description inside and out, right? Really know how to speak to the job description and really the qualities that they are looking for in the role, and really the skills and the job description that you'll be doing. A lot of people get this a little bit confused, and they kind of veer off and start talking about random things when you should really be structured when you're answering the questions and really answering why you are the only one qualified for this role and why they should choose you for this role. So competence is very important. Now, let's say you're a nursing student, a senior nursing student applying, and you think, well, I just got a nursing school, or I haven't even passed my NCLEX yet. Should I apply for this position? My answer is yes, absolutely. You don't want to waste time. A lot of new grads sometimes will say, well, let me pass my NCLEX first. Let me wait for my nursing license. And what happens is they don't understand that sometimes it could take 3 to 6 months or even longer from application to actually getting a job offer. So sometimes some new nurses will sit out for 6 months to a year and struggle in getting a position. So you don't want to fall into that situation where you're sitting around waiting. So my advice to you, if you're a nursing student, senior nursing student, or a new grad, I would say apply at least 3 to 4 months in advance. So for me, I applied months in advance and I got hired as a nursing student into the emergency department. So it is definitely possible. You don't have to pass your NCLEX, and you don't have to have a license number to apply. Okay. So competence is really key, and really preparing yourself to answer these questions so that you can demonstrate your competence. Okay. The other reason why it's important to prepare for interviews and to get a nurse career coach like myself is, for example, clinical style questions. They'll ask you behavioral style questions, and they will also ask you clinical style questions, especially if you are a new nurse, right? Why do they want to do that? They just want to get a sense of what you know and really what you've learned in nursing school. So, especially if you're going to critical care areas such as the emergency department, the ICU, labor and delivery, or the PICU, like pediatric ICU or something like that, they really want to make sure that they're getting people who are able to critically think and adapt quickly and answer questions. So, this means that if you're, for example, going to an interview for L&D, right, for labor and delivery, then guess what? You better be prepared to answer some common questions for L&D. Things like placenta previa or placenta abruptio. Like, what do you do if a woman starts hemorrhaging, right? This could be before, during, or after birth, or whatever the case is, right? So definitely know clinical emergencies in the areas that you're going to be going into. Let's say psychiatric emergencies if you're going to psych, or even in the emergency room, because a lot of psych patients come through the emergency room. What else? In the OR, right? You might want to know some safety questions that they may ask you in the OR, or things that happen after getting anesthesia. I can't think of it right now. malignant hyperthermia, right? That's something common that can happen in the OR or in the PACU. So make sure that clinically, your stuff. So that's where that competence comes in, is the first C. Let me know if you're watching. I don't know if I'm out here alone. Say hello. Let me know if you have any questions. Let me know if this is helpful. And put a 1 if you're out there listening and maybe you don't want to ask too many things. I just want to make sure that I'm not out here by myself. But even if I am, that's okay, because I know that you guys will be watching the replay. And if you do watch the replay, just put replay. Let me know if this was helpful for you. And let me know if you have any questions. And if you'd like to work with me, definitely message me or put career coach if you're interested. Okay. Next C on the 5 C's of interview success. The first one was competence. And number 2 is confidence, right? So confidence is extremely important. I cannot stress this enough. Okay. So you might say, okay, I've been a nurse for 10 years or 15 years, but I still struggle with confidence. I don't really know how to demonstrate this confidence when I go into my interviews. And part of it could just be the fear of changing, right, into a different role or in a different unit. And sometimes it's just our own self-limiting beliefs and our mindset. So you got to get your mind right? That's number 1. You got to think that you are qualified, you are able to get the position. And if you are in the interview phase, that means they want to hire you. So stop with the, thinking, am I going to get this role? I don't know if I'm good enough. Because if you're going into the interview thinking all these thoughts, you're just going to sabotage it, right? It's self-sabotage. So it sounds cliche, but mindset is extremely important. And I tell my clients all the time, my nursing clients, if you don't believe that you will get the position, then guess what? It's going to be written all over you. You're going to go into that interview not feeling confident. You're going to be nervous, anxious, and they're going to see that, right? And typically, the most confident people during the interviews are the ones that get hired. So this is why, when I work with my clients, the number one thing that they usually say after we're done the interview sessions and we work together and they get clear on what it is that they need to improve and, we work together, the number one thing that they talk about is how confident they are going into the interview. And if you look at my LinkedIn recommendations or on my website, if you go to nursefarah.com, you can see the number one thread in all the testimonials, the video testimonials, all the written testimonials. Confidence is really what they say that they come out of after working with me as a nurse career coach. Okay. So really, to be confident is number 1, you want to be prepared for the interview. So you want to know how to answer these questions, both clinical style questions, behavioral style questions, and really how to present yourself. They're going to ask you, tell me about yourself, or they're going to say, walk me through your resume. Really, that introduction is so important. The first 2 to 3 minutes of an interview is extremely important. So I'm talking about confidence from, the way that you dress, right? You gotta slay, right? You gotta slay not only in the interview, but in your outfit. Like, you cannot wear your typical black suit or black dress. Everybody wears, that type of stuff. You want to be able to stand out. So I always tell my clients, like, wear something that's going to be comfortable, but something that's going to help you stand out. So one of my clients that I worked with recently, she slayed. She had this really nice light blue dress and she had a white blazer, right? And she was from California and she actually got a same day offer. And they actually complimented her on how she looked, like her whole style and how she was dressed. It is very important to invest in yourself and to get a really great outfit, okay? I also worked with someone in the past, and he said he was just going to wear like a white shirt and roll up the sleeves and all that. And I'm like, no, 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 we're not going to do that. So I said, you need to really invest in a really nice looking suit so that like you literally turn heads, because first impressions count and they matter, especially during interviews. So please don't show up looking raggedy, okay? That's what I always say. Please dress to impress and wear something different. Don't be afraid to wear color, you know, jewelry that pops, something really cool, glasses, whatever it is. Part of your personality should be in what you wear to go. Obviously, keep it professional, but don't be afraid to use color. Okay. So, again, confidence in how you speak, how you enter the room, all that really counts. And really, if you're prepared with your interview, prepared with your questions, then you're going to come across really confident. And one thing that I find that a lot of people do during interviews, and I think it's just human nature, and sometimes I do this, I speak really fast sometimes, right? But I think it's important to slow down during an interview if you're someone who speaks really quickly, because you want to be able to demonstrate your knowledge and you want them to be able to understand what you're saying and not speak too quickly, right? And if you look at all the great speakers, um, a lot of them will pause, right? They'll pause, they'll take their time, and they'll really articulate their words, okay? So just remember that, because some of my clients sometimes when they get nervous, they get like they want to speed through the questions. So we work on really making sure that they take their time and answer the questions in a manner that comes across confidently, right? So again, if you're just joining, I'm talking about the 5 C's of interview success and how to slay your next nursing interview. Okay. Let me know if you're watching, if this is helpful, put a 1 in the comments. And let me know if you have any questions about interviewing, or if you're nervous about your next interview and you need some help, just reach out to me and we can do a consultation call. I only accept a couple clients a month. So, reach out to me as soon as possible, because when I fill up to my quota, I don't take any more for the month, because I want to make sure that I'm giving my full attention to my clients. And then, so like I said, we're talking about the 5 C's. C number 1 is competence. C number 2 is confidence. So we talked about those two. And the next C is communication, right? So communication obviously is going to be very important during your interview, right? You want to be able to communicate with clarity and be concise in your answers, but not too concise. You want to be able to give examples and demonstrate your knowledge, competence, and clinical skills, and articulate your value. Okay. So sometimes they may ask you a question, and I've seen where sometimes some nurses will be quick in their answers, because they'll just say like 1 or 2 word answers, but you don't want to do that. You want to be able to provide a little example. So let's say they ask you, what are your 3 greatest strengths? Okay. You may list out the 3 strengths, but after each strength, I would give them a little example. So maybe, you say one of your strengths is critical thinking. You can give an example of where maybe if you're a new grad in nursing school, you demonstrated critical thinking, maybe you caught something, you advocated for a patient, something like that, where it ties in to prove, and demonstrate your critical thinking skills. Okay. So that's kind of one thing. The other thing with communication, obviously, is like the nonverbal communication, right? You want to make sure that when you enter the interview, if it's a virtual platform or in person, that you maintain eye contact, that you're, again, communicating clearly and concisely, and then articulating your value. And what do I mean by that? A lot of nurses are very humble, right? They don't want to seem like they're showing off. But guess what? Do you want the job, right? Do you want the job? Because in order for you to get the job, you need to be articulate. You need to articulate your value, right? Basically, you need to brag about yourself. So I always say you got to bring your swagger and you have to brag. I call it the brag and swag method, right? And that comes along with that confidence. And you're not bragging. Truly, you're not. You're just simply stating facts. Okay. If you're certified, like I'm 6 times board certified, when I go to interviews, I'm just stating facts, right? Board certified 6 times, certified emergency nurse, certified pediatric emergency nurse, NEABC, nurse executive advanced board certified. I'm just listing it and stating the facts, right? If you have certifications, bring your receipts. Don't be afraid to tell them. If you have gotten scholarships, like I've gotten scholarships from the Emergency Nurses Association, ENA, a doctoral scholarship, that was huge. Throw that out there. If you volunteer, throw that out there and really demonstrate what you're doing for the community, how you make an impact. Just wrap it all up and articulate it and state the facts. That's all we're doing. We're just stating how fabulous we are, how great we are, and why we should be hired for the role. Like that's why you're there, right? So again, let me repeat the first 3 C's that we went through. So the 5 C's of interview success. Number 1, competence. You need to demonstrate how competent you are for the role. Number 2, confidence. You need to show up with confidence and be prepared so that you can really shine during your interview. And then number 3, be ready to articulate and communicate your value and answer the questions appropriately so that you could show this confidence and show your knowledge and why you're the one. Okay. And then number 4, the 4th C is connection. Okay. This is truly important to me. I talk about this to all my nursing clients. I say that, we're in the profession of nursing, even though we may not always be giving direct patient care, let's say in a hospital setting or outpatient setting. Guess what? We're in nursing. It's the profession of caring, the profession of helping others, and the profession of just dealing with people, right? People dealing with people. So think about it, HR, right? Human resources, right? You have to be able to connect with people. Yes, you can communicate, but you need to communicate in a way that you connect with people, that shows not only that customer service aspect, but just that human aspect. Like, how do you connect with others, right? Are you able to make small talk, and really get along with people? They want to be able to see that connection piece. So if you're able to connect with the interviewer, that is really key, and it'll elevate you from the rest. It'll help you stand out from other candidates, especially if you're in a panel style interview where there's multiple people that are interviewing you. You need to learn how to connect with each interviewer. Or sometimes you might be in a panel interview with other candidates, and how are you able to stand out from those other candidates, right? And it's that connection piece, right? Putting it all together, and really how you connect with people and how you carry yourself, right? So let me know again if this is resonating with you, if this is helpful. We're talking about all things interviewing for nursing, and really it's not just nursing. This can help you if you are in another industry and you happen to be watching. These same principles can be applied to really any industry. But of course, my specialty is really working with nurses and really helping them be successful in their job search and really landing their dream job. Okay, so again, the 5 C's of interview success. Number 1, competence. Number 2, confidence. Number 3, communication. Number 4, we just talked about connection. And then lastly is number 5, character. Okay. So, character for me is really just showing up in your authentic self, like, right? Showing your character, talking about your values and how your values align with the organization, talking about, you know, your why, your purpose, because everybody has a story of why they went into nursing and what particular population they'd like to work with or what type of impact they would like to make in the nursing industry, right? So for me, early on, I loved emergency medicine. I used to watch life trauma in the ER, and I fell in love with that style of medicine. I knew I wanted to be an emergency nurse from the get go. I loved that fast paced energy. I loved meeting different people in a day. Like sometimes, literally, we would meet anywhere from 50 to 100 people, especially when I was in triage. You would constantly be triaging everybody, and you would see a lot of individuals come through. So I also would, love that fast pace because I'm somebody who stayed calm and cool. And I love things that were exciting and always changing. And I was able to adapt quickly. So I knew that was my environment and that was my thing. Later on, that changed into education. I realized that I love educating nursing students and I love taking on new grads to really show them the ropes of nursing. So then that led into more education and then later into leadership. So really that's the beauty of nursing. There's so many things to do. But I always say to my clients, if there's a part of the interview where maybe you feel a little bit nervous and you're not sure how to answer something, I always say, go back to your purpose and to your why and just talk about your passion for that particular area. So maybe it's pediatrics, maybe it's psych, maybe it's L&D or emergency or critical care, whatever it is. When you start talking about your passion for that area, it's going to be so clear that you're a great fit for the role, or whether it's leadership or education. Just start talking about your passion for it, your values, what impact you'd like to make, and what you can bring to the role and to the organization. Because one big mistake that a lot of people do is they keep talking about during the interviews, like how great the organization is and what the organization can do for them. And like say it's a magnet hospital, they're like, oh, I want to work there because it's magnet and da 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 da, right? It's okay to say that, but you also have to, put it out there, like, what are you going to bring to this organization to make it better, to improve their patient experience scores, right? To really be compassionate when you're dealing with the families, because we know it's not just taking care of patients or whatever it is. So really showing that passion, that character, and a piece of your personality will go a long way during your interview. So again, to wrap up, those are the 5 C's, Farah's 5 C's for interview success. All right. Again, number 1, competence. Number 2, confidence. Number 3, communication. Number 4, connection. And number 5, character. I promise you, if you're prepared for your interviews and if you get a nurse career coach like myself, you'll be a lot more confident and relaxed during your interviews, that it should really just be conversational, right? It shouldn't be like an interrogation type style. And if you want to learn more about interview skills, you could follow me on LinkedIn. If you happen to be watching YouTube or Facebook, still follow me on LinkedIn. That's where I do most of my content. I'm going to be putting out more short form videos on how to interview, job search tips, career success for nurses. And I also have Instagram. I'm not that active on it, but I do post some videos there. And let me know what other style questions you may have, anything about the job search process or interviewing that you would like to know. Direct message me or drop it here in the comments. And I hope that this was helpful. Like I said, I'll be doing more of these lives weekly, and I'll also have different guests where we'll be talking about different nursing topics. We'll talk about basically nurses who are interested in starting their own business. I have a book called Nurses Making Money Moves, A Nurse's Guide to Starting a Business. You could find it, hold on, you could find it on my website. So I should have had it closer. You can find it on nursefair.com. And it's called Nurses Making Money Moves, A Nurse's Guide to Starting a Business. If you want to start a side hustle, I highly encourage, whether it's tutoring, consulting, or coaching, you can get this book again at nursefair.com. And just Google me. I have a lot of articles that I share on different platforms like Sigma, Minority Nurse. I'm a contributor for them. And I speak as well if you're interested in different topics like personal branding for nurses, or you need a speaker at your next event, definitely message me or check me out on my website, nursefair.com. Please reshare this if it was helpful. Tell your friends about it. Tell your nursing friends about it. Until next time, thank you. This is Dr. Farah Laurent, aka Nurse Career Coach, and I will talk to you soon. All right, take care.